Hi Pineapple Mamas, welcome back to my IUI series. Today we're going to be going over required testing for IUI. I'll let you know what's needed and why it's so important. So if you're interested, then keep on watching. Hi, my name's Ashley Nicole and my channel is all about helping you through infertility as well as then pregnancy and parenting. Before we start off, I want you to know I am not a medical professional. This is purely from my own research and experience, and you should always seek the consultation of a physician for all fertility treatments. So let's get started. First off, all of these tests are subject to findings. It depends on the results of the test, what test might come next. But these are the basic tests that are required for IUI. Starting off with the male, he is required to do 2 tests. The first test is the semen analysis. This is so that the physician can see if the couple is suffering from male factor infertility, where the sperm count is low or the quality is low. As far as going more into detail on that, go and check out my What is IUI video. I'll link that up above. The second test for the male is going to be an infectious disease blood screening. This is to protect both parents and the unborn baby from getting any infectious disease. Moving on to the women's test, these will be quite extensive because she will be the one carrying the baby. They also will have to have an infectious disease blood screening in order to protect the unborn baby. The next test is a prolactin blood test. This is to see if you are producing too much prolactin, which would basically secrete the follicle stimulating hormone, which is FSH. By the way, follicles are fluid-filled sacs that sit on the outer part of the ovary that hold immature eggs. FSH helps regulate your cycle and grow that immature egg so that it triggers ovulation. So as you can see, if you make too much prolactin that doesn't secrete the FSH, then you will not ovulate. Which is why they are going to test your FSH levels as well. High levels indicate that you might have ovarian aging or decreased egg reserve. Next is a thyroid test. Hyperthyroidism is the production of too much of the thyroid hormone and can cause irregular cycles. It can also cause pregnancy-related issues like miscarriage and preterm birth. And hypothyroidism is where you produce too little of the thyroid hormone, and this can interfere with ovulation. The following test is a progesterone blood test. This test is actually going to be done several times throughout your fertility treatment. And the reason why is because progesterone hormone actually makes the lining around your uterus thicker. This is basically just to make a nice little comfy bed for the little egg to implant. So during your cycle, progesterone thickens the lining of your uterus so that it makes a nice little comfy space for that egg to implant. And if an egg doesn't implant, then your body will shed the lining of your uterus, and as you know, Aunt Flo will show up. Now, progesterone does fluctuate. It actually is on the lower side at the beginning of your cycle, and then once you ovulate, it increases for about 5 days and then starts going back down. This is why they do test progesterone throughout your cycle to see how you are producing it. Another test that's done in order to check the thickness of your uterine lining is going to be a vaginal ultrasound. So in this ultrasound, they want to check to see that your uterus lining is thick in order for you to have a safe implantation when they do inseminate you. The next ultrasound is a diagnostic ultrasound. This is basically to see how your follicles are developing, if they're developing too many or too little during an unmedicated cycle. Now, if you're having a medication-assisted IUI cycle, then you're going to be having clomiphene. Clomiphene is basically a drug that's going to increase estrogen levels as well as GnRH and FSH and LH levels. I know, I just said a bunch of letters. Let me explain them to you. Okay, so GnRH is gonadotropin releasing hormone. This helps the release of the FSH, which is the follicle stimulating hormone. That helps to make the immature eggs in the follicles grow. Also, gonadotropin helps to release the LH hormone, which is the luteinizing hormone that helps you ovulate. Are you still with me? Okay, so that clomiphene drug is what's gonna help you ovulate. Now, sometimes we need some help with ovulation, or we need to help increase the ovulation, which increases the eggs released, which gives you higher chances during IUI. So you'll have an ultrasound in order to make sure the clomiphene, also known as Clomid, which is one of the popular brand names, is working properly. Now, they'll also use this ultrasound prior to giving you clomiphene in order to see if you have any cysts around your ovaries, because this can inhibit follicle growth. Now, it can also make the cyst larger when you have clomiphene. I myself had a ruptured cyst after I had my IUI and became pregnant, and let me tell you, it is not pleasant. Okay, this next test is an HSG test. It's a hysterosalpingogram. For this test, you do have to go to a special imaging facility. What they're going to do is they're going to inject a specialized dye into your uterus so that they can see if it spills out on each fallopian tube. Now, the reason for this test is to see if there is any blockage in either fallopian tube that would somehow inhibit the egg from reaching the uterus. This test can also show if you have any uterine abnormalities, and it also has been said that when having this test, the dye does release any debris that's in the fallopian tube that helps to increase the chances of you getting pregnant. And this lasts for about 3 months. The reason why you have to go to a special facility for this is because they have to do a guided HSG test through x-ray. So basically, when they inject the dye, they want to be able to see it immediately if it spills out. This test can be a little bit uncomfortable, but I would definitely say, having had it myself, that if you breathe through it, it's definitely tolerable. Now, I know I went through a lot of tests and a lot of information, so you can definitely go to pineapplemamas.com in order to see everything written out in one of my blogs that will better help you read and understand it. And make sure to stay tuned for my next video, which is going to be how to prepare for IUI, where I'm going to go over everything to help increase your chances and how to prepare for the actual treatment itself. Thanks again for watching, and don't forget to hit that notification bell and that subscribe button if you want to join our Pineapple Mamas community, where we are women supporting each other. And remember, stay hopeful and stay happy. I'll see you in my next one.